Hello, everybody. This is Gary. Today is December 29th, Thursday, 2022. It is 4:33 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today I'm doing okay. I went out and did my physical therapy and walking exercises. I did some work on my computer, and I'm making this video as part of my daily schedule. My symptoms today are not that bad. My paranoia levels are pretty low. My delusions are pretty low. My anxiety levels are pretty low. My depression is not that severe. And I am having auditory hallucinations, but they're at a very bare minimum. My voices are not command voices or command hallucinations. They don't tell me to do things. Um, they just tell me that people are following me, spying on me, plotting against me. I could usually ignore them. I listen to music. I meditate. I can do a lot of things um, to ignore my voices. Some people may not be able to do that. I usually can. I did go to the psychiatric emergency room about 2 weeks ago. They held me for 26 hours until I could talk to a psychiatrist, and they eventually sent me home after 26 hours. I saw my therapist and my peer support specialist the 2 days after that. A peer support specialist is somebody who has a mental health diagnosis and works on staff as a counselor at the clinic that I go to, or any clinic really. And of course, I do have a primary therapist as well as a psychiatrist. My primary therapist has just changed. I had my first meeting with her yesterday with my old therapist. And moving forward, I will be seeing the new therapist. I'm seeing her next week, I believe, on the 6th of January. And I'm seeing my psychiatrist on the 8th, or the other way around. I would have to check my schedule. But I usually keep all my appointments. It's very rare for me to miss a medical appointment, or a psychiatric appointment, or a therapy appointment, or a counseling appointment. I pretty much keep all my appointments. Um, which is important when you have any kind of mental illness. Um, for me, it's especially important to keep my appointments during the winter. The winter tends to make my depression and anxiety worse. It kind of increases my auditory hallucinations, my paranoia, delusions, anxiety, and depression. Today, the weather wasn't so bad. I mean, it is December, so it's cold outside, but it wasn't bitterly cold today. Um, Tomorrow I have to go to the pharmacy to pick up some of my prescriptions before New Year's. I think the pharmacy will be closed on New Year's Day, so I want to get my prescriptions before they close on New Year's Day. And they have restricted hours on New Year's Eve. I use Walgreens pharmacy, but I'm meeting with my psychiatrist next week. I don't think we're planning to change any of my medications. Everything seems to be working with my medications the way it's supposed to. Um, we did reduce the Zyprexa because I had a urinary catheter inserted for urinary retention. I have had prostate surgery and urinary bladder surgery to correct my urinary retention. But sometimes my medications can cause urinary retention and constipation, one or the other or both. So they inserted the catheter. I wore it for about a week and a half. Then they withdrew the catheter at the outpatient urology office and filled my bladder with purified filtered water, and to see if I could void it out. And I was able to void it out. And I did not need to keep wearing the catheter, but my psychiatrist did reduce the amount of Zyprexa I was taking because it might have been the cause of the urinary retention. Um, but there's not much else to report about anything going on right now. Things are kind of slow. I'm pretty comfortable. It's cold outside. I have a place to live. I'm grateful for that. A lot of people don't. So I'm just doing the best I can. Like, comment, share, subscribe.